Dr. Leigh, let's talk about periodontal disease, gum disease. Here's something I observed. When a person has gum disease, dentists keep telling us that we will be losing our teeth 2, 5, 10 years down the road, whatever, however, nobody really knows how fast it snowballs, but it will definitely one way or the other way happen. And this is very bad, of course, but at the same token, you dentists do implants and other things wonderfully. It's not anymore like in the old days where George Washington apparently had a wooden tooth. That must have been, tough. But so you're doing a good job there. But here's what I see. I mean, the teeth, the gum disease is there, and it's a disease. It's an infection, that yellow, reddish, ugly pus. It's all over the mouth. When you eat, it mixes up with the food beautifully. It goes down in the stomach, and from there goes everywhere. And, of course, the mouth in itself is the gateway to the blood vessels. I mean, just take B12 or any some such stuff. They dissolve under the tongue. Why? They go into the blood much faster than anywhere else. So you have that yellow reddish pus going into your blood, dripping down the heart, going up a foot to the head, saying that's why gum disease is known to be heart disease and stroke, lowered immune system. Women who are pregnant seem to be having premature births and underweight babies, kidney failure, all kinds of things are happening. Dr. Leigh, it looks to me, and correct me if I'm wrong, please, because we want to get, I want to get your opinion on that. And isn't that stuff even more devastating than losing the teeth, which at least with some money can be replaced?
Absolutely.
Yeah?
Well, I'd just like to add that they're finding a linkage now to Alzheimer's disease and pancreatic cancer.
Oh my
so
God.
If that's not enough, if that is not enough motivation, then I don't know what is for people to treat their gum disease.
Well, let me tell you one. Maybe it is, maybe it isn't. Apparently, a Japanese university studied and found that people who have HIV, which thanks God isn't the many, they have the HIV virus, are much more likely to develop AIDS because of it, because they lower the immune system. We have that basketball player, what's his name, who was running
Magic
around.
Johnson?
Yeah, I guess. Was running around with HIV or is for a long time. But he probably has a pretty dang good immune system, you know what I mean? So
sure.
It doesn't develop. Does that stay forever? Most likely not. But most likely there will be a measurement that when he does develop AIDS, that also in that proportion his immune system went down due to normal age, overdoing it in sports, whatever it is. At one point we all get it down a little bit. So as again, thanks God not everybody has that problem, but if it gets something so severe, wouldn't it make you tired and fatigued and sluggish throughout the day and all that type of stuff?
Sure, absolutely. I couldn't agree with you more, and I think a lot of people are maybe just used to feeling that way when maybe it's just not normal. Right.
There's many of those areas where we go, oh, well, I'm getting old, and we laugh and we make a joke. But really the joke is on us, and the truth is, at whatever age, we can always find people who are much better off than we are. So no, it's not just the age. It's, wonderful. So, okay. You see, for instance, have you noticed that many surgeons, the guys who do the appendix operation, the tonsils, or for that much the hip operation where they use the same material, hip replacement, and you guys use for implants, the titanium, the knee operations, that those people, those surgeons lately, the last very few years, very, very heavy, demand a clean bill of oral health. And they're not concerned about a cavity here and there. They're not concerned about having crooked teeth and needing orthodontal work. They're just concerned about gum disease. Because they say if you have gum disease, your body's infected, your immune system is down, that the infection can travel to the surgery I do in the hip or in the stomach, wherever I do it, and it can ruin my surgery, or the body is pre-weakened already so much that my weakening it from my operation might really create a problem. Have you noticed that more and more patients come to you and say, I need a clean bill of gum disease thing?
Yes, and it's not easier. It's not that easy to get them to that bill of health either. So it's important that everyone maintains their gum health all the time so that when they need that surgery, it's not delayed because they have to spend 3 to 6 months getting their gums back to health.
Right. No, absolutely. And again, if surgeons demand that they say, look, your body is predisposed, your body is weakened, I cannot do these other things. It has been for a long time that a surgeon will not touch you if you have a bronchitis going on acute right now. He'll not do appendix operation on it. I mean, he might take a bullet out if there's no other choice or such an emergency surgery, but rather than that, he'll not operate on you. So, But now it has found that a gum disease is just as devastating as that, because a disease is a disease. Yellow pus is yellow pus. It doesn't matter where it happens. In fact, the mouth is where it goes the fastest. So if that is happening, we should realize that we're really self-imposing our body and then wonder why every flu season we get sick and we spend in bed time and we're at least stuffy and sneezy and the co-workers don't want to be around us and all that baloney. Right?
Yes. Yeah. I can only agree with you. Yes.
Wonderful. Yeah, I mean, it's quite amazing that when we have a little, like a dime or like a quarter of an infection in our hand or somewhere where we can see it, and it doesn't go away for a week or whatever it is, we probably run to a dermatologist, as we should. But in here, it looks like we have a much larger surface than a little, penny, and we don't do anything about it.
Well, that's one of the things with periodontal disease is that it's painless. It doesn't hurt. A lot of times when it gets to that point, then it could mean losing a tooth, and it takes a long time to get to that point, which is why we diagnose it early, and really this is one thing that we really push the patients on getting treated early, because it does create those systemic problems. And we also forgot to mention diabetes, which is it's a sign of diabetes also. So it's painless, it's chronic, and when your gums are bleeding, it's not normal. You need to come see us immediately.
It looks like it's like they say we have a sudden heart attack, but we really don't have a sudden heart attack. It built up for a decade or 2 or 3, and so this gum disease seems to be rather similar. It builds up for a decade or so, but in the meantime it ruins everything. In fact, you might then have a sudden heart attack just because of that.
Absolutely.
Or at least contributed. It's not that one, but it's the body is a synergy. It works together. Well, all right. So patients should go to and maintain. And let's maybe talk in another session of like what improvements have been made in terms of like batting this gum disease, how to fix it. Because I heard there have been quite some technical advances which make it easier. Thank you very much.
Much easier. You're welcome. Thanks.
Beautiful.